Welcome back. My next guest is Dr. Owen McGonigle, who is with Bluegrass Orthopedics, an orthopedic surgeon. Welcome.
Thank you.
Now, I mentioned hip pain causes and cures. So, hip pain, where does it hurt? I mean, where's your hip hurt? I mean, is it your groin? Is it your back? I mean, all kinds of places it can hurt to be hip.
Yeah, so when we think about inside the hip source of pain, the classic place we'll see it is more kind of deep in the groin. A lot of times people will come in and see me in the office and they'll point towards their buttocks area or towards their back and say my hip hurts, and we tend to associate that more commonly with back pain and areas, maybe some of the muscles that are around the hip. And when we look at injuries or pathologies that occur inside the hip, we tend to see much more kind of the groin, or sometimes people even make a C and kind of point on the outside part of their hip using a C sign to describe the area of pain.
So what are some causes of hip pain?
Well, we can kind of break them down into different age groups. The most common thing that we see in a younger patient population will be something like a hip labral tear. And as people get, see the older populations, it becomes things like hip trochanteric bursitis or what's called a gluteus medius tear, which are some of the muscles on the side of the hip. And then hip arthritis is a very, very common one as well.
Now, you mentioned labral tear, and that's a little more common than I would have thought, but tell me, what are the symptoms of that? What might make you think that?
Yeah, so most people won't remember a specific injury that happened. Every once in a while that will be the case, but more often than not it comes on without really realizing it. And most people, before they come and see me, will have had symptoms for even multiple months, because it starts as more minor and kind of gradually becomes more and more bothersome. They will describe that pain typically deep in the groin that we were talking about. So a lot of people will describe some catching or grabbing or feeling like that something is stuck and needs to kind of pop or unstick. It's usually related to the degree of activity. So more activity, walking for a longer period of times, or certainly athletic type stuffs, running, jumping, cutting, pivoting, that stuff tends to make the symptoms worse as well, particularly things that twist or pivot the hip.
Well, now, I said hip labrum. Maybe you should explain what the labrum is in the hip, because that may not mean a lot to a lot of folks.
Yeah, and a lot of our joints have a labrum, and their functions are different on different joints. When we talk about the hip is a ball and socket joint, and really the function of the labrum is more like a gasket seal, and so it normalizes the pressure within the hip and allows the hip to move smoothly within that ball and socket. And so if it becomes disrupted, some of that the pressure in the hip changes. And can change the way that the hip moves and how it functions.
So what do you do about it?
Well, initially we try to treat it conservatively, like a lot of things, and so sometimes initiating some physical therapy to work on the muscles around the hip, actually to mobilize the spine and low back in order to try to decrease the incidence of the hip pinching on a labrum can be successful, and so that's usually the first choice. People that have had a prolonged period of symptoms that failed that, we would consider doing things like an MRI in order to better understand, is there a labral tear, make sure there aren't other pathologies which are less common, things like maybe avascular necrosis of the hip, which is can be associated with certain other medical conditions, or arthritis that's developing maybe that can be part of the problem as well.
Surgical repair?
Yes.
Possible?
It is, yep. And it's actually something that, if you go back even 15 or 20 years, it was quite uncommon, but we're doing it more and more now as we really get a much better understanding of the labrum as a source of pain and which patients do well with that. And so we do it now through an arthroscopic approach where there's small poke holes around the hip, and we're able to, in most cases, reattach the labrum to where it was torn, allow it to heal in.
Okay. Now, real quickly before you got out, you also mentioned trochanteric bursitis. That can be really painful, but it also can be easily fixed sometimes.
Yeah. So in some cases, again, this is one that there's a lot of overlap from different areas, but typically the difference with a trochanteric bursitis is people will have pain more on the side of their hip versus deep down in the groin. Usually it's related to sleeping on that side, walking for longer periods of time. Similar to the labral tear, we'd start someone with some physical therapy, and usually an injection in that area can give them some symptomatic relief. For people who have these symptoms that don't get better with conservative treatment, though, we sometimes have to look a little deeper, because there's a muscle there called the gluteus medius, which is what holds your pelvis upright when you're walking. That can tear over time. We almost compare it to a rotator cuff in the shoulder. It's a similar function in the hip. And some people, that can be a source of persistent and chronic pain that could need to be treated as well.
That's great information. Thank you for coming in. And if you've got hip pain, Bluegrass Orthopedics can help. We'll be